This is a technique that's typically used for dermatitis, but can also be used for lesional biopsies, such as small pigmented lesions or even large pigmented lesions which can't be removed via shave biopsy. So we begin with cleaning the site with an alcohol wipe. We then use our anesthesia. And when doing the anesthesia, for this aspect, it doesn't matter too much as far as whether we raise a wheel directly under the lesion or around the lesion, so long as the area is anesthetized. We would let that anesthesia take hold in a few minutes, but given this pig's foot isn't feeling anything, we'll clean the site with an iodine wipe in preparation for the biopsy itself. For this procedure, I'm using a 3mm punch biopsy, which does not have the ejector. Some of these instruments have an ejector, which may in some cases make it easier, simply because if the biopsy itself remains in the biopsy hub, you can eject it out. However, it is not necessary. If you have one that does not have a plunger, the biopsy instrument is hollow and a simple wood tip applicator from the backside can push the biopsy out. We isolate the lesion. We put our pinky on the patient. That way, if the patient moves, we can adjust to that movement without going too deep. We want our biopsy to be perpendicular as possible. We use gentle pressure, rotating the instrument, allowing the blade to do the work for us. Once the biopsy is done, remove the instrument. We can use our forceps to remove the punch sample from the patient and place it in formalin for submission to the laboratory. Now keep in mind that when doing punch biopsies, as I mentioned, they're typically for dermatitis and sometimes small pigmented lesions or large pigmented lesions that can't be removed. This procedure can also be used for biopsying chronic ulcers to rule out any presence of malignancy or possibility of vasculitis. If this is the ulceration, we want to do 2 punch biopsies, one in the center of the ulcer bed and the second around the epidermal surface that surrounds the ulcer. This is done for 2 reasons. One, the biopsy in the center would show any evidence of malignancy, and any biopsy that's performed on the skin surface would show any possibility of an inflammatory process that may be causing the ulceration, like a vasculitis.